Right now, heading into 2026, trends are shifting quicker than I've ever seen them before in my 20 years working in this industry. One interesting trend is that people want to protect their identity. Almost 90% of the patients that I see are asking for identity-driven outcomes. Welcome back to AgeLess. I'm Dr. Jonquille Chantrey, surgeon, published expert and trend forecaster to some of the biggest think tanks in beauty and pharmaceuticals. So in today's episode, I'm breaking down two things: the defining aesthetic trends of 2025, what they taught us and what surprised us, and the 6 trends that will dominate 2026. Rather than hype or marketing, these are real trends impacting choices and behaviour. And these are some of the ones that, as a global thought leader, I believe actually count. This episode exists to give you clarity because, yes, trends, they can absolutely empower us, but they can also distort our sense of perspective and our own identity. And in the wrong hands, they can cause very real harm. And remember, if this episode resonates, please subscribe, like, share this episode with someone you care about. So let's dive straight in. What did we learn in 2025 for both patients and practitioners? This year, one theme absolutely dominated the aesthetic world, and this was regeneration. All aspects of PRP, collagen stimulators, biostimulatory injectables, everyone wanted regeneration. And in my own practice, PRP became the #1 standout treatment. And this fascinated me because I'd been performing this procedure for 20 years since my time as a full-time research plastic surgeon. So this year, my patients told me that this had the biggest impact cohesively on their overall appearance in years. But here's something that people missed. While the world was rushing headfirst into biologics, the real headline became safety, or lack of it. We saw huge gaps in evidence and in ethics, in the understanding of what these treatments can actually do. And more patients walked in with AI-generated regenerative protocols that didn't have any clinical grounding at all. So what's the big learning here? Regeneration must be purposeful, it's got to be personalized, it's got to be measurable and psychologically responsible. It can't just be reactive, and it definitely can't just be a viral trend. And the generational motivators around this were really clear. Gen X used regeneration to maintain their confidence and maintain power in their career. I found that millennials wanted prevention, but without the overcorrection that they'd seen in media and in their friends over the previous years. My Gen Z patients wanted the instant results and the prevention, trying to protect their future self. Trend number 2. Longevity moved from wellness into mainstream medical aesthetics. My patients are super well researched. This year, they came in asking about inflammation, glycation, hormonal balance, which micronutrients they need, how to support their muscles, and many of the foundations of biological youth. I saw my scientific work on collagen science and the serums that positively influence skin aging gain huge interest. And it became more and more apparent to me that people no longer see youthfulness as something that's just surface level. They want to understand and influence the biological process. And I really believe that we have to hold the line on the importance of diversity, because different ethnicities age completely differently at both a cellular and a structural level. Meanwhile, celebrity biohacking and peptide cocktails raised expectations that most patients simply couldn't and possibly shouldn't replicate. Many were left financially drained, disappointed, and confused after longevity hacks exploded quicker than the evidence could keep up, and as the marketing sprinted miles ahead of medicine. Trend number 3. The filler fear cycle has started to shift. After 3 years of panic online, many people dissolved everything, only to realize they'd lost structure and experienced accelerated visual aging that they'd never seen before. Celebrity no-filler declarations didn't help, especially when many still had access to highly sophisticated private interventions, including lots of different treatments, and many had had undisclosed interventional surgery, further misleading the consumer. My own patients, however, took a far more considered approach and continued to maintain their treatments using strategic hyaluronic acid. And they're now telling me that they're so glad that they did, because they've continued to look consistent and natural. Let's be clear, there was huge amounts of really bad work where anatomy, physiology, and attractiveness just weren't respected. And in those cases, I believe that they did need to be reversed. Trend number 4. Rapid weight loss through medication has reshaped the entire aesthetic landscape. With rapid weight loss comes facial laxity, shifts in fat pads, muscle loss, skin dryness, skin barrier disruption, and a huge emotional impact. This is something I've seen since I saw my very first patient who presented to me on one of these in 2020. But the global surge really hit hard in 2025, with celebrities obviously amplifying the trend. Hugely positive emotional shifts of confidence and well-being stories has been paired with negative comments about how tired or saggy people look, as well as them noticing muscle loss and skin laxity on themselves like they've never seen it before. Trend number 5, using combination therapies to achieve results. Single treatments lost relevance entirely. My published data showed higher patient satisfaction when combinations of treatments are used to treat anatomy in a multi-dimensional approach, way over one type of treatment. And this was more evident than ever in clinical practice. Truly natural results come from respecting the whole architecture instead of relying on a single promised miracle solution. Now for the trends that I predict will dominate in 2026. First, regenerative aesthetics, but with intelligent protocols. Regeneration needs to become disciplined and not impulsive. Tissue, collagen, and elastin stimulation will be more foundational than ever. And I know that biologics will continue to surge, with new products and companies entering the industry more than ever. But the science-led clinicians of the industry will definitely demand proof of safety and efficacy. So my message to you is that regeneration must be personalized with intention and always evidence-based. Number 2, longevity is now cemented as the new aesthetic blueprint. I'm talking about health span, and health span not just of our lives, but of our tissues. I'm seeing more and more of my patients ask me for treatments that target things like inflammation, glycation, their mitochondrial performance, and muscle quality. Now, this is something that I've practiced in my clinic, One Aesthetic Studio, for a long time. And I prescribe and encourage the use of protocols that bridge topicals, technology, lifestyle, and biomarkers, the very convergence of wellness that I predicted a decade ago. Number 3, the return of trust in hyaluronic acid and seeking out clinical excellence. For this, I predict a slow but a steady comeback for safe and tested hyaluronic acid. Not for volume, but for balance, structure, and hydration. Industry opinion leaders, including Alice Hart-Davis, are reinforcing the deserved trust in expert injectors who had been performing clinical excellence in this area for many years. What I want to make clear is that hyaluronic acid was never the enemy. Poor technique, unskilled providers, even if qualified, and unethical trends were the problem. And we'll see patients who chased alternatives begin to notice that they're aging in ways that they didn't expect. I think the truth will finally surface that filler never failed the industry, but technique did. So what was the lesson? The next decade belongs to deep anatomical expertise, conservative artistry, and multi-layer strategy, a skill set that goes so far beyond what's just technically good. Think undetectable micro contour. Next trend, number 4, skin tightening in the era of rapid weight loss. Laxity becomes one of the biggest concerns of 2026. We need to tackle fat pad descent, dermal skin thinning, and collagen depletion. My one method that I use with my patients in my clinic includes lots of different things. It includes ultrasound, radiofrequency microneedling, collagen stimulators, hyaluronic acid support, and advanced skincare, as well as many other methods. After many years of treating patients with rapid weight loss, I always go back to my ethos that we're recalibrating the architecture of a completely changing body. Number 5, multi-modality everything and treating every anatomical layer and seeing a really positive global shift towards my core philosophy that natural results require a whole anatomy approach. For the face, it's things like hydration and actives, collagen structure, brow and muscle strengthening, and skin performance optimization. And for the body, it's things like resistant fat reduction, muscle strengthening, and things like Profilo Body for a deeper level of hydration and skin stimulation. I'm excited to say that I really hope that the era of false promises through single solutions could be over. And finally, my trend number 6, body strengthening becomes aesthetic medicine. 2026 is finally the year that muscle becomes a longevity organ, and we see strength becoming synonymous with beauty, posture, metabolic resilience, and confidence. Innovations such as neuromuscular facial training and body sculpting machines such as PowerSculpt and MLift lead the conversation with many of my discerning patients who are already looking for these treatments. And as I regularly put it to my patients, as well as in my research, aesthetic results will now rest on the strongest foundations: assessment, diagnosis, strategy, and power. The aesthetics industry is changing because we're evolving, not just because of trends. Our biological understanding is advancing, and it's reshaping our psychological views of it. If 2025 taught us anything, it's definitely that trends can mislead. But 2026 gives us a chance to reset and shift from aesthetic medicine as a reaction and an impulse to expectation, and towards aesthetic medicine as science-led self-empowerment. My 2 takeaways for today's episode. Number 1, choose regeneration by understanding true cellular aging. Not everything labelled regenerative is safe or evidence-based. So seek practitioners who you can actually have science-based conversations with, not just about beauty and small talk. Number 2, treat the layers, not the lines. Aging is multifaceted and it's multi-layered, and your treatments should be too. Look for expertise that respects anatomy at every level. The most natural results come from an artistic, anatomically precise sequence. As a thank you for being here, you can redeem an exclusive 15% discount on the One Dermafacial and a complimentary skin consultation with my team at One Aesthetic Studio. Use the link in the show notes and enter Trends15 at checkout. If you found this conversation valuable, we'd be so grateful if you could please subscribe, share it with someone you care about, and please let us know the questions that you want answered. Together, we're redefining how we age, how we look, live, and feel. I'm Dr. Jonquille Chantrey, and this has been Ageless.